My name is Bruce Odell, and I kind of wanted to tell you how Injury Management Services LLC came into being. In 1994, I was working at Rapides Regional Medical Center in cardiac rehab as a clinical exercise physiologist, and I was teaching in the diabetes center as a certified diabetes educator. We actually went through the process of getting it ADA recognized, and I taught the exercise component in that center. My wife worked for a local physical therapy group that had 5 clinics, and we met, and they offered me the opportunity to come to work for them and start an industrial rehab program. In this offer, they provided a stipend for me to return to school in occupational therapy, and I talked to my wife, and we had just built a house, and we loaded our kids up and we drove to Denton, Texas, and I enrolled in Texas Woman's University to obtain a master's in occupational therapy. While I was there, I stayed and did an extra 6-week rotation at Baylor in Irving, Texas, in industrial rehab, returning here and starting to work for the group in January of 1999. From that point on, the majority of my continuing education was focused on industrial rehabilitation. I lectured to the LSU medical students on the role of exercise in the management of diabetes. I provided educational talks to companies around Central Louisiana on cumulative trauma disorders, tendon entrapment, proper lifting. We did back schools. I met once a week with employees of Pepsi and did safety talks weekly. I lectured to case managers, nurse case managers, and HR personnel on how to interpret FCEs and the testing that was used to identify symptom magnification, how to manage workers' compensation claims as part of their continuing education. The services that we provided then were agility tests, post-offer pre-employment testing, fit-for-duty testing, functional capacity evaluations, functional job descriptions, and not least, but my favorite, work conditioning. And as an exercise physiologist, I love getting people in shape, and people that are going back to physically demanding jobs like offshore, or people that are working as linemen installing poles in the ground, putting cross arms overhead, have to be physically fit. And when you've been off for a while, a lot of times the employer will order work conditioning prior to doing a functional capacity evaluation to get the individual in shape before they test. They will score better and do better. So during this time, I became certified by the American College of Sports Medicine as a clinical exercise physiologist. Again, I obtained my master's in occupational therapy and a master's in sports science. I became a provider for WorkSavers pre-employment testing program, as well as WorkSteps pre-employment testing program, both of which are national pre-employment testing companies. The reason that we decided to use these national companies is that these nationally affiliated agencies, is that they provide training, they provide policy and procedures, as well as ongoing support for anything that you run into during pre-employment testing. And I promise you, every time that you think that you've seen it all, that day you will see something you do not know to handle, and you pick up the phone and you call somebody that is dealing with hundreds of companies around the United States, and they can walk you through what to do step by step by step, and you can walk the employer through what to do step by step by step. They also monitor any kind of Supreme Court decision, all new employment law, and they update and change how they do tests, and they change their policy and procedure manuals based upon this new employment laws or changes in the law. By 2004, I had become a certified functional capacity evaluator, a certified behavior-based ergonomic specialist. I had completed the essentials of AMA impairment training, therapeutic seating assessments, pain management certification through the University of Southern Indiana College of Nursing and Health Professions. I had been to McKenzie cervical spine and lumbar spine evaluation, but in 2004, this partnership that I worked for dissolved, and some kind of way, by the grace of God, Injury Management Services LLC was born. I didn't know where I was going to work, but I knew all I knew how to do was industrial rehab. In 2005, I completed a course on building an occupational health workplace consulting practice to guide my fledgling little company. I also completed water survival and helicopter underwater regress training and the Safe Gulf training through the Acadiana Safety Association in preparation for doing functional job descriptions offshore. I am currently located in a building, it's a new building with elite physical therapy and mid-state orthopedic and sports medicine. We have a symbiotic relationship, really all of us. And if you wonder why occupational therapists are frequently hired to do industrial rehab, is that occupational therapist degree and training is to focus on the life roles that are lost through illness or injury. So we focus on the life roles that were disrupted, where physical therapists focus on the biomechanical issues such as strength and range of motion. Occupational therapy is a type of health care that helps solve the problems that interfere with a person's ability to do the things that are important to them. Physical therapists are biomechanical experts, and I have 6 physical therapists that are employed by Elite Physical Therapy, which each have their doctorate degree, DPT in physical therapy. They assist me if I need assistance with evaluation of a neck, a back, a hip, and I assist them by providing services for their patients as they are discharged. Their patients need impairment ratings based upon the AMA. They need work restrictions for them to return to work, or for the vocational rehab person to look for different type of employment if they're unable to return to their pre-injury job. I offer functional capacity evaluations, fit for duty testing, work site and workstation ergonomic assessments to reduce the risk of injury when their patients are returning to work. We all work together as one team. Midstate Orthopedic and Sports Medicine is also located in the same building, and we have 9 orthopedic surgeons and 1 board-certified physiatrist that, among other things, does EMGs and nerve conduction testing. Once their patients reach MMI, they need impairment ratings based upon the AMA, work restrictions, disability evaluations, work conditioning, work readiness rehabilitation, and some of their patients that do not follow the clinical model of recovery may benefit from the Progressive Goal Attainment Program, or PGAP. PGAP is very exciting. It's an evidence-based treatment program for reducing disability associated with pain, depression, cancer, and other chronic health conditions. So when patients do not follow the normal clinical model, sometimes it may be fear, catastrophizing, these things, and they're not progressing. The PGAP system is a system that is structured, that provides an activity coach that helps these people work through some of the issues that may not be grounded in fact. They may fear things that should not be feared. And through a structured program of increased activity and attempting them, you lessen their fear and they're able to progress. It's a great program. Bart Jones and Don Cassano are owners of Elite Physical Therapy. They have a staff of highly trained physical therapists that are an integral part of injury management services. I personally think that Bart Jones was around and treated Moses' knee when he crossed the Red Sea, because he's treated everybody in central Louisiana. And if he hadn't treated you, he treated one of your relatives. Everybody loves Bart. Don Cassano, Don works extremely hard at improving his knowledge and his skills, and he's recently become board certified as an orthopedic physical therapist, an OCS. To my knowledge, he's the only one in central Louisiana. Both have their doctorate degree, their DPT in physical therapy, and together they work hard to build a premier evidence-based care center that strives to establish itself as one of the providers of choice for non-operative and post-operative musculoskeletal disorders. They give each person that comes here questionnaires on their perception of abilities at the point that they're entering therapy. At the conclusion of therapy, they reassess them on their perception of abilities, of how they feel they have improved, to hopefully match the objective data that they've collected as part of their discharge summary. They also evaluate how the patient felt about the staff that worked with them. This data is collected and reviewed by both owners, and they're continuing to make improvements in quality care for their patients. Elite is comprised of 10 rehabilitation specialists with over 100 years of physical and occupational therapy experience. When you come to Elite Physical Therapy, you're assigned to a team of physical therapists and a physical therapy assistant, and you see the same people day after day after day that is familiar with your medical condition, familiar with your treatment plan, and they progress you back to your highest level of functioning.